This video is going to go over dilator training. So I'm not going to put the dilators in the video just for fear that YouTube might take it down thinking it's something that it's actually not. So when you are going to do dilator training, the first thing you want to do is prep the space. So typically patients will do this in their bed just because there's a door that you can shut, give yourself a little bit of privacy, make it easier to relax. I have had patients that do this in the bathtub just because they can recline back and it's easier to clean up any lube that slides out. So whatever works best for you. If you're going to do it in bed, go ahead and put a pillow or something up against the headboard. Put a towel down so that it can catch any excess lubrication, and then have a couple of extra pillows, okay? So you're going to lay down or kind of just prop yourself up so that you're reclined, and then use the pillows to prop your knees on. Now the key for this is you want your inner thigh muscles relaxed, so you don't want to have to hold them up. Those inner thigh muscles will generate some tension within the opening of your pelvic floor as well. And then you want to be sort of reclined back enough that you can relax, but that you can still reach the vaginal opening. If your muscles are on and you have to crunch forward, again, that's going to increase some muscle tension there. So kind of get into this position so that you can do it with as little extra muscle activity as possible. And then take the dilator, whatever size you and I have talked about starting with, and apply lubrication on all sides of the dilator. You want it lubed up at the top, but then also further down, okay? Then take a couple of fingers on one hand, separate labia so that the vaginal opening is right there, and then place the dilator up to that vaginal opening. Then you will slowly insert, just doing your belly breathing. And the goal for this really is to keep that pain 3 to 4 out of 10 tops. Ideally, we want it under 3, so in that 0 to 2 out of 10 range. You're going to gently and slowly insert the dilator until you reach a point where it does get into that 3 to 4 out of 10. Then you're going to stop, pull it out just a smidge, do some deep breathing through your belly. Some of the different tricks that we've talked about that help your pelvic floor relax. So the belly breathing, you can even try like a squeeze, relax, squeeze, relax, squeeze, relax of your pelvic floor. See if that helps those muscles relax. The third option is just visualization of something warm. So I teach my patients to visualize a really hot skillet, and you're just putting a pat of butter on that skillet and it's just going to melt instantly. So anywhere you feel touch inside of you, visualize that you're the skillet and that dilator is the stick of butter and it's just melting right around it, okay? If you can do any of those techniques and reduce that pain into that sort of safe threshold, go ahead and continue inserting, again, until you reach that point. Now, if you have inserted and you can't get it to get into that safe space with those 3 things, go ahead and pull out until you are in that 0 to 2 out of 10 range. And then just try to sit there with those muscles in that stretched position for a couple of minutes, okay? Now, for the purposes of most of my patients doing dilator training, this really is just to get those pelvic floor muscles to be okay with the stretch sensation. We are not physically stretching the vaginal opening. You certainly can, and I would have had that conversation with you already. That's typically post-cancer treatments, post-surgical incisions where we're working on scar tissue and such. But for most of my patients doing dilator training, it really is just to get those muscles at the vaginal opening to be okay with stretching without pain entering the equation, tensing up, and then causing discomfort during intercourse. Remember the airport analogy, right? The longer you live around the airport, it's not that the planes get any quieter. Your body has just realized that that is not a stimulus that it really needs to pay much attention to. We want to get those muscles right at the vaginal opening to be okay with the stretch without it being a threatening stimuli and causing pain. So if you are feeling like you're a little bit stuck, that's okay. It's even normal to be able to progress to one dilator further one day and then struggle a little bit more the next day. That's very, very normal. Our pelvic floor is incredibly receptive to stress, physical stress, emotional stress. So if you've had a rough day or you've been more constipated and your pelvic floor's been under a little more tension, those things are going to influence how the dilator training goes. So don't get upset. Don't, start to think that, oh, everything's getting worse. It's never going to get better, because it's not true at all. You can do this. It takes a little bit of practice. Some people progress faster than others. There is no right or wrong. It just is your personal journey. And I wish you the best of luck. And let me know if you have any questions. You got this.